afternoon, everyone. It is 1 o'clock. My name is Alex Castillo-Smith. I'm with the Human Services Department. Thank you for joining us for today's COVID-19 update. We are joined by Secretaries Tracie Collins with the Department of Health, David Scrase with the Human Services Department, as well by our state epidemiologist, Dr. Christine Ross, who are going to provide some comprehensive updates. And then after that, I'll facilitate questions and answers with our media partners. So let me ask today's speakers to turn on their camera if they've not already, and then we will get started with Secretary Collins.
Thanks, Alex. Good afternoon. Happy to present a vaccine update. Next slide, please. So as far as the doses delivered to the state and shots in arms, New Mexico continues to lead the country as being the most efficient vaccine distributor. So great news. Next slide, please. So as far as our progress with vaccinations, for New Mexicans 16 years of age or older, 65.7% have received one shot. And then 56% of New Mexicans are fully vaccinated, which is really great news. Next slide. Additional updates, all counties are now turquoise. So given the state's vaccination progress and continued positive outlook with respect to new virus cases, counties will remain at the turquoise level, barring any exceptional circumstances. And that will continue for the duration of our use of the color-coded county-by-county system. We will continue to closely monitor vaccination rates and step up efforts to make vaccinations even more accessible. Next slide, please. So given that our goal is 60% by June 30th, we are on track. When 60% of New Mexicans 16 years of age or older are fully vaccinated, we will graduate from the red, yellow, green, turquoise county color system. Please keep in mind that Native communities are sovereign and may operate according to different guidelines. Next slide. So if you want to learn more about becoming a vaccination site, please go to getvaxnm.com. This is something that we can open. We open it up to businesses, nonprofits, religious organizations, schools, and we've had really a great response, but we want to see it continue. Next slide. Keep in mind that we have now more than 970,000 New Mexicans who are registered for the vaccine. You go to vaccinenm.org. You can schedule your own vaccine appointments, including your second shot or your booster. Next slide. And the vaccine is free for everyone. I want to reiterate that. The vaccine is free, there's no cost. And you do not need a social security number or government ID to receive your free COVID vaccine. Next slide. And we do not, as a state, share immigration status information with the federal government. Please keep in mind, vaccine sites are safe. And next slide. So some exciting news. We have now started Vax to the Max sweepstakes. So you can be eligible to win a lot of cash, and you can also win prizes, staycations. It's really exciting. So please register at vaxtothemaxnm.org to be eligible. So keep in mind, you need to have received at least one shot in New Mexico, and you do have to register to be put into eligibility for one of the prizes. And so we have great prizes. It's exciting times. So if you've not gotten your vaccine, now's the time. But keep in mind, even if you got your vaccine back in December, you can be eligible to win a prize. You just have to go back in and register at vaxtothemaxnm.org. Next slide. If you need support getting scheduled or to get registered for the sweepstakes, please call us at one of these numbers, and we can help you get yourself registered for the sweepstakes or your vaccine. Next slide, please. So I just want to reiterate, we're all doing a fantastic job. Thank you for the work you're doing in New Mexico. We're standing together and protecting one another. And now it's my pleasure to welcome back Dr. Christine Ross, our state epidemiologist, who's going to talk about vaccine effectiveness. Dr. Ross?
Thank you, Secretary Collins. I'm happy to be here this afternoon. So I'm going to give a brief update on COVID-19 vaccine effectiveness and the work of the Department of Health to monitor or conduct surveillance of vaccine breakthrough infections. We are highlighting this topic today because there have been a few questions by reporters and the public related to this topic. So I'm happy to provide some further information today. So next slide. So first, let's start with definition. So what is a COVID-19 vaccine breakthrough infection or case? So this is when a person tests positive for SARS-CoV-2 or the virus that causes COVID-19 after the time period elapses when we consider a person fully vaccinated or protected. So this is 14 days after completing an FDA authorized vaccine series. There are some additional caveats to this case definition, which has been normalized across all the states and jurisdictions to help us decipher, is this a new infection after vaccination or not? So we do exclude persons from this case definition that had a recent previous SARS-CoV-2 positive lab or a positive lab within 90 days. So even with these caveats, we do find that not all cases that we originally identify as a vaccine breakthrough infection or case ultimately are determined to be a true breakthrough case. So next slide. So I think from my talk today, I really want to emphasize and make it extremely clear that COVID-19 vaccines, the 3 vaccines currently authorized here in the United States, are highly effective. And they are a very critical tool to continue to help us bring this pandemic under control. However, no vaccine on the market is 100% effective. And this is amongst COVID-19 vaccines and other vaccines in general. So no vaccine is 100% effective. So what does that mean? It means that vaccine breakthrough infections are expected. The good news is that even when a vaccine breakthrough case does occur, there's evidence that the vaccination likely reduced the severity of illness that a person experiences. So next slide. So now let's zero in on actual vaccine breakthrough infection surveillance data. So all states report vaccine breakthrough surveillance data to the Centers for Disease Control and Prevention. And this is so that the rate of vaccine breakthrough cases across the United States can be monitored. So this first bullet highlights a recent publication by the CDC called an MMWR publication, which found that among 101 million fully vaccinated in the United States at the time of that study, that they were able to identify somewhere around 10,000 vaccine breakthrough infections. What that equates to is 0.01%. So extremely rare. So these were reported across 46 US states and territories as of April 30th. And I included a link there to that study if folks are interested in more details. And then the second data focuses more precisely on our surveillance data here for New Mexico. So among over 900,000 fully vaccinated New Mexicans, we have identified 696 breakthrough infections. This was as of June 1st, for also a very low rate of 0.074%. So when we look at this data in finer granular detail, we don't see any surprising patterns among demographic groups or any pattern related to vaccine type. And again, further investigation takes place after we've we first identify a case through our surveillance system. And again, after further investigation, not all will be determined to be true vaccine breakthrough cases. So next slide. And again, this is a little bit more detail of our surveillance data. So among those very few vaccine breakthrough infections that we have identified, 67 persons were hospitalized. Of those 67 hospitalized, upon further investigation, only 15 were likely to be COVID-19 related. Similarly, you can see a very low rate of deaths. So 8 deaths have been identified among our vaccine breakthrough cases identified through surveillance. After further investigation, 6 of those deaths were determined to be related to COVID, either as an immediate or an underlying cause of death. And it's important to also understand that these individuals typically have multiple comorbidities or pre-existing conditions and typically very complicated medical histories. So next slide. So finally, I want to end again on what is really the larger story here, which is that the COVID-19 vaccines are highly effective. So clinical trials were conducted prior to authorization of the COVID-19 vaccines, and these demonstrated really high efficacy and safety, but very high efficacy in preventing COVID-19 illness, including severe disease. And after these vaccines were authorized, the science doesn't stop. We continue to study the vaccines to evaluate how they're performing in real world circumstances and in changing conditions, such as with emerging variants. Thus far, the vaccines are performing very well. These studies that are being conducted will also be used to inform us on our ongoing vaccine development efforts. And I believe that might be my last slide. One more. So just again, take home message from me is that looking at all of our surveillance data to date, I want to share this fact very clearly that nearly all the new COVID cases, hospitalizations, and deaths are among persons that are unvaccinated. So again, I have shared today some of our vaccine breakthrough surveillance data so that folks understand that these efforts are underway, but the rate of vaccine breakthrough cases thus far is very, very low. So please, New Mexico, get your shots, get your COVID-19 vaccine as soon as you can. And that's it for me. Thank you very much.
Thanks, Christine. Thanks, Tracie. It's a privilege to be on a panel with these 2 esteemed doctors. And I know a lot of work has gone into culling through those cases in people who, or at least positive test results in people who have already been vaccinated. And, you know, the epidemiology department keeps putting out great reports on the DOH website. 2 more recently published ones are variant of concern reports, which I'll touch on today briefly. And then they have a new pediatric case report that came out, and you may be interested in looking at some of the data here. This is our epidemiologic curve. I feel kind of funny presenting this with Christine on the call today, because normally I'm the one listening to her present this, but just as review, the blue graph here is the graph of cases in all of New Mexico, and then the 5 lines underneath, which nicely meld almost into a single line near the end where we want it, are the 5 regions of the state. And you can see that we are now at a case range of 132 cases per day, averaged over 7 days with that famous 6-day lag to make sure all the data gets in and we have a chance to file the case in the correct date. This is really a low point. You have to go all the way back to September 20th to find a data point that low. And it's nice to see this downward trend and some of the news that Tracie shared that I'll reiterate is related to our success with our case counts and the decline in the vaccine, the decline in cases due to vaccinations. We're still vaccinating 33 people for every one case we see daily. It was great to come back after a long weekend and find out we had an average number of cases over 4 days that averaged less than 100 a day. And that's been a long time coming as well. So another exciting trend and very, very positive for the state, and allows us a lot more freedom, I think, to reopen and do some other things to ensure that that at least most of us have a really good summer. But speaking of good summers, Alex, if we go to the next slide there, I see the summer as being two different kinds of summers. I think there's going to be a summer for fully vaccinated individuals where you have a really, really low chance of being infected. And then the summer for unvaccinated individuals, well, there'll be a much higher chance. And I've got some numbers for you in a couple slides. So particularly people who are unvaccinated, who are going to mass gatherings, are not regularly wearing a mask, are not practicing social distancing, and actually who live in a county, for example, where they interact with people every day where the vaccination rate is low. All of those things can significantly increase one's risk of developing COVID. And part of that is the variants that we're seeing here in New Mexico. So Alex, next slide. Yes, this is the summer for unvaccinated people. I don't know about you, but the left side of this slide looks particularly more attractive to me than the right. And we even have some fish in there for New Mexico fishermen. Next slide. So Christine and her team in epidemiology put out this report every couple of weeks. B117 went from being really 0 cases. The United Kingdom variant went from 0 cases back in January to being almost 70% of all of our cases. And there is some fairly good data now that it tends to spread at 1.5 to 2 times more quickly, is more transmissible than what we had for the first part of the pandemic. We saw a rise in California variants, and those now, as you can see, are back down below 5% on the slide, and some of the other variants are listed here. But our patterns here in New Mexico pretty closely reflect what we've seen in the Southwest and also what we've seen in the country. And I think the main point, though, is with B117 is the fact that it can spread more rapidly. The other thing we've talked about in the past is it's resistant to some of the treatments. So we've changed out our treatments here in New Mexico to account for this and to make sure we're using antiviral treatments that actually cover the B117 variant. Next slide, please. There was a great article in the Washington Post, A Tale of Two Summers, a pandemic among the unvaccinated. And this is kind of a complicated graph, but it's a wealth of information. And what it shows, first, let's start with the dotted line on the top, adjusted US rate. This is what's happening in the rest of the country. And you can see basically since pretty early January, New Mexico has done better. This is the case rates per 100,000. The line on the bottom is actually the curves, the prevalence curves that we've had in our state, different than the epi curve, but you can see that bottom line there is just everyone in New Mexico and the data we continue to report every day to the CDC. And then what the clever authors at the Washington Post did in their statisticians is they extracted out all of the unvaccinated people with a predictably low infection rate. And that red line, I think it's a red line, on the top refers to unvaccinated individuals. And so you can see the case rates right now among unvaccinated individuals really aren't that much better than they were on March 3rd. In fact, that they are starting to decline again, which is good news with more and more people getting vaccinated. One nice thing for unvaccinated people is that every time someone else gets vaccinated, it lowers the risk of an unvaccinated person from getting a case. But what we're seeing in the data in our own data out of DOH is that basically if you take every case we've had from January to May, you're 15.5 times more likely to be infected with coronavirus if you're unvaccinated than if you're vaccinated. Next slide looks at hospitalizations. And you can go on to the website and look at this yourself, although the deaths graphing today isn't working. But same curve, same adjusted US rate, same bottom curve of all of New Mexico, substantially better than the rest of the country. And I really thank the governor and everybody, everyone at DOH, HSD, CYFD, all and every department in the state. Trouble is, once you start thanking people, then you realize it's too long a list to make it all the way through. But you can see that we're way, way below the rate for the rest of the country here, less than just about half now. And you can also see that when you take out the vaccinated individuals, that the case rate, again, is similar to where we were in early February. Your chance of being hospitalized with COVID if you're unvaccinated is 10 times higher than if you're if you're unvaccinated. You have 10 times the chance of being hospitalized than if vaccinated. And deaths, unfortunately, now, and this is this sort of the pandemic amongst the vaccinated, death rates among unvaccinated people are now 22.6 times higher than for vaccinated people. So even if you don't like math, I really think there's something in this slide for every unvaccinated person. You may choose not to be vaccinated. Of course, you got 3 doctors here that would advise against that would advise you to be vaccinated, but at least you know the risk that you're taking. And again, for yourself and for your family, really consider getting that vaccination to lower your own risk. Next slide, please. Our gating criteria are all green. It's really nice. Everything is doing well. I had expected test positivity rates to rise. We got a lot of reporter questions in March on that. We've been working on the math in February, but testing is staying up, and that's really good to see. That's how we find cases. That's how we find people to isolate and so they don't infect other people. It's how we quarantine their contacts. Our modeling still shows that the contact tracing that we're doing and isolation and quarantine are a huge factor in fighting the pandemic. And so it's great to see the New Mexico firing, as it were, on all 7 out of 7 cylinders here. I know there's no such thing as a 7-cylinder engine probably, so don't bother putting that in the Facebook chat. Okay, next slide. Vaccines, we're doing great. Completed vaccinations up to 56% today. That was yesterday's number. We're still well ahead of our target for today, that is 50%. So we're doing really well. We think we're on track. Completed vaccinations is what we report on the website, and full vaccinations is just 2 weeks after that. And so when we first hit, the day we hit 60% completed vaccinations, we'll set the timer exactly 2 weeks after that. We will be at full vaccination based on the CDC definition of that extra 2 weeks to allow full immunity to kick in. And so we're excited about that. We're still on track. You can see the curve is bending downwards. There are many of us at the state who believe that we're going to see the same sort of results in New Mexico like we saw in Ohio and other places with the lottery, where a lot more younger individuals and more rural people who live in more rural areas will step up and take the vaccine. And so we're hoping to see the same benefit here in New Mexico. And I still remain confident we're going to make our target only 4.2% and 2 weeks away. Next slide, please. So the map is all turquoise, and that is due to a number of reasons. Actually, when we recalculated it according to the previous approach, I think we had 4 yellow counties, mostly toward the eastern part of New Mexico. But I think, and I know actually, I just talked to her, the governor feels so confident in our vaccine efforts and so desirous of restoring economic balance to the state that she has generously put forth in the direction that Secretary Collins signed today in the public health order, that until we're fully open, all counties will be turquoise. And so that's what the map's going to look like until we get to that 60% complete vaccinations, and 2 more weeks after that when we get there. And then we won't have a map anymore. We still will continue to monitor. On the next slide, Alex, I think I already did this slide. So, but again, we're very confident in our progress with the vaccinations and with everything else that's going on. The cases are coming down. The vaccination is working. People are still being careful, which is particularly important if you have an immune disorder, if you live with someone who has pre-existing conditions. And so I'm really happy about this. I'm really pleased to see that restaurants and other public venues will stay open going forward at the turquoise level. Next slide, please. And I think we're on the home stretch now. Oh, just to point out a couple of things. We still will publish the red, yellow, green metrics for you. For example, if you go down to Rio or Ariba there, they're at 14 cases per day per 100,000, which is higher than our target at 10. They're below the test positivity target. Alex, maybe you could follow with your pointer so people can see where I am, because the print is small. But a great vaccination rate, way to go, 62.5%. The other thing that is sort of chilling and interesting to me is these are ordered in by county according to vaccination rate. Los Alamos still at 79%, about 3 times the vaccination rate of the lowest county. And so it does have a couple 616s in the last column. I believe those will change to June 30th for the duration, but you can still get this data. And I know the governor's had conversations with mayors and others in asking them to continue to promote vaccination, to promote COVID safe practices until the pandemic is over, not just mainly over for the vaccinated, because it's still actually spreading more rapidly among the unvaccinated individuals in our state. Okay, so final slide here is just, you'll be fully vaccinated. Remember, 2 weeks after your second dose of the Pfizer or Moderna vaccine, or after a single dose of Johnson & Johnson. I hear tell that some places in the state will start distributing Johnson & Johnson in emergency rooms in a couple of weeks. So another way to touch people that we might not see very often. Please get registered and get vaccinated. Be aware of these new variants and your need for caution if you have an immune disorder, pre-existing condition, or are unvaccinated. Everyone should still get tested if you have symptoms, and if you do get a positive COVID test, find out about treatment, because it is actively keeping people out of the hospital. And the usual guidance we give you here, remember the face covering guidance that applies mainly now to unvaccinated people in most public situations, all indoor situations, and most outdoor situations. And so I think we have wonderful news. We're seeing the fruits of our labors, if you will. I'm really, again, thankful to our partners, my partners here today, Secretary Collins and Dr. Ross, as well as the people behind the scenes. Just want to thank Alex Castillo-Smith, Matt Bieber, Matt Nerzig, and Jody McGinnis-Porter, who've really worked tirelessly to keep these presentations running and keep us on time. So with that, I think I'm going to turn it back, and we're open for questions.
That's right. Thank you, Secretary Scrase, and thank you, Secretary Collins and Dr. Ross, for your presentations as well. And so I'd like to ask the media partners to raise their hand if they have a question, and I will call through them. And I'd also would just like to kindly request that you limit your questions to 1. That way we can get through all reporters who would like to ask a question today. So first, let's start with Julia Goldberg with the Santa Fe Reporter. Julia, go ahead, please.
Thank you, Alex. Thank you very much, doctors. So I had a question related to long-term care facilities. The number of facilities with COVID-19 cases that's listed on our daily reports has been steadily rising. There were 25 yesterday, there were 9 in mid-April. And I'm just wondering if you can speak at all about what you're seeing in terms of vaccination rates and the long-term impact there. I'm sure you saw National Geographic just did a story about the deleterious impact of COVID-19 in such facilities, specifically focusing on a facility in Albuquerque. And Alex, I'm sorry, really quick second question. Dr. Ross, the Centers for Disease Control and Prevention at the start of May said they were going to be monitoring breakthrough cases differently and just looking at ones with that resulted in hospitalizations and deaths. It sounds as though New Mexico is not taking that tact. I just wanted to confirm that and ask if that was sort of the long-term intention. Thank you very much. Sorry, Alex.
Let me start with the first question, Julia. And I've been working with Katrina Hotram Lopez on long-term care facilities, and actually vaccination rates there are pretty good. I don't have the numbers right in front of me, but I will get those to you today because we have a slide from last week. But resident vaccination rates are in the 70s in nursing homes, and I think the very high 70s in assisted living facilities. Staff rates running about 10 to 15% low below the resident rates, but still way, way better than the national average. We too are concerned about the uptick in cases. We're really trying to balance the pretty intense and continuous demand of family members to visit. You know, that's good for the health of people in nursing homes. As a geriatrician who's worked a lot in nursing homes, I can tell you that those residents who get visitors, you know, do have more of a positive outlook than those that never do. Of course, they're using Zoom techniques and connecting people by video camera. I think that ultimately we are looking to try to boost vaccination rates even further in nursing facilities amongst both residents and staff, and allowing changes in visitation only in those places with higher vaccination rates to get it. What you're talking about, that's something Christine and I were talking about last week, and I was talking with the governor's staff today, and we hope to have some new targets. I think what we're going to see, particularly in congregate facilities going forward, is no testing in the best of times for when there are no cases for vaccinated residents and staff, and more intensive testing when there are no cases for unvaccinated residents and staff. Of course, in a nursing home, an outbreak is defined as a single case. So as soon as there's a case in either that or a assisted living facility, then we go in and test everybody. So that's really the approach we're taking. We're concerned too. We still get the daily report on that we look at every day. And I think just keeping up COVID safe practices, in particular, remember that it's really people coming in from the outside that bring these infections in to the nursing home. So if you're visiting someone in a facility, you just do not even want to think about going if you have the slightest kind of symptoms. And we want to protect people there the best we can. But watching closely while we try to balance the healthy aspects of visitation with the obvious unhealthy aspects of what happens if someone acquires coronavirus, particularly in that age group and that setting. They really are our most vulnerable people. I'm going to go on to Christine on the second question about our approach, and then Tracie, you can add to either of ours.
Sure. Yes. Thank you for that question. And you're correct. So the CDC recently announced that they'll be shifting their vaccine breakthrough surveillance efforts to focus on cases that were either hospitalized or died. And we also have plans to make that shift as well. And the reason is you really want to focus in on those vaccine breakthrough infections of real significance, or where there is a bad outcome. So in other words, if you have a vaccine breakthrough infection and someone tests positive for SARS-CoV-2 and they have mild cold-like symptoms, we really don't need to continue monitoring that moving forward. What we want to know are those cases who become ill after vaccination and require hospitalization or even ultimately die. And the reason that is we want to study those cases very closely to understand what were the circumstances surrounding the vaccine breakthrough infection, and was there anything related to an emerging variant, for example. So that is why this shift is taking place with the CDC and then also with our own surveillance efforts. Thank you.
And I don't have anything to add. I agree with everything that's been stated, so thank you.
Thank you, everyone. Okay, next I'll go to Dan McKay with the Albuquerque Journal, followed by Matthew Reichbach with the New Mexico Political Report, and then Algernon Damasa with Las Cruces Sun News. Dan, go ahead, please.
Hi, I'm hoping one of you or more than one of you could address the future after the color-coded system goes away. When we graduate out of the map, will we still have an emergency public health order of some kind in place? And if so, why, and what would be some, are there regulations that we should expect to still have around at that point? And I'll mute myself now. Thank you.
Well,
Yeah,
for that question, go ahead, Dr. Scrase.
well, you go first and I'll
Thank you. And so, yes, the goal is to open up, but we will still need to maintain some sort of surveillance and keep track of cases, but we will no longer be using this color scheme. So people will be free to go about and do their activities safely. And then we want to evaluate ongoing what makes sense to keep New Mexico safe. But please be clear, the goal is to open up.
Yeah, and Matt, I think it's a really good question because it kind of teases out the tale of two summers and the vaccinated people and the unvaccinated people. Remember that even though everything will be open, businesses are still free to implement their own requirements. And I got to tell you that even though I'm allowed to go everywhere I want to without a mask anymore, it is still a little comforting sometimes if I'm going inside someplace and it says mask required and I get inside and it's kind of more than a crowd that I'm quite comfortable with just yet. And so I think there will be still a public health order, particularly related to masking and other safe practices for unvaccinated people, in my opinion. Second thing is that recall that the state with somewhere in the top three or the bottom three lowest per capita incomes gets an enormous amount of revenue from the federal government to support programs, mainly in HSD on a regular basis, like the food program, SNAP, or like Medicaid enrollment. And we've gotten substantial extra benefits, student SNAP, the PEBT cards. And so though the state is eligible for those benefits, as long as the state has declared a public health emergency and the federal government has declared a public health emergency. So as the Secretary of Human Services Department, you're going to hear more from me going forward about the other half of the pandemic, which is what's happening to low-income people with unemployment and everything else. And so I would certainly be an internal advocate in state government and have been to continue the having an official state of emergency and public health orders in the state to allow us to continue to get that federal revenue, which I think is actually, we will have need for months, if not more than a year after the federal government, officially feels that the pandemic has gotten to the point from a virus point of view that we can relax. So in summary, I think we still have to have some rules. I think there still will be regulations as long as the CDC has them for unvaccinated people. And I think we want to maintain a position as the state that allows us to take advantage of federal revenues when they're offered. And we expect the federal government to help us figure out how to gradually unwind things next year, next calendar year, and they're already issuing guidance. Sorry, it's a long answer, but it's really important that we watch out for those folks who are unemployed and continue to get them benefits as long as we can.
Thank you, secretaries, and thank you, Dan, for that question. Matthew, go ahead, please.
Hi, thanks for taking my question. In regards to the vaccination rates, I noticed that a lot of the counties with very low rates are in border counties. I wonder if with the vaccine lottery or sweepstakes, whatever we're calling it, if you expect that we'll see an increase of people saying, hey, I got my vaccine in another state, and when you expect that to help. Thanks.
So thank you, Matthew. I appreciate the question. And yes, there will be a proportion of people in those border counties that could have received at least one vaccine in another state. But keep in mind, the requirement to be eligible is that you have one shot in New Mexico. So we still feel like there will be a nice pool of residents who can look to being eligible for the sweepstakes.
Thank you, everyone. Algernon, go ahead, please.
Thank you, everyone. My question, I want to revisit prisons and detention facilities and just check in on what efforts have been made to get vaccinations to people in these congregate facilities, your sense of the progress that has been made, and finally, whether those inmates get CDC issued vaccine cards and if they're eligible for the sweepstakes. Thanks.
Yes, and thank you for that question. Secretary Tafoya Lucero over Corrections has done a phenomenal job with getting staff and inmates vaccinated. They are looking at really high percentages, so I applaud her for that. At this time, they're not issuing like cards to the inmates that I'm aware of. The question about their eligibility for the sweepstakes is an interesting one. You know, I know who's not eligible, and that would be myself and other GovX employees who've been appointed. We're not eligible, nor are members of our households. But as far as persons in detention or corrections, I'm going to have to actually look at the rules and get back to you.
Okay, thank you, everyone. And we have a final hand.
Alex, one other thing. I think my understanding is that inmates in federal prisons use the federal vaccine supply, and in state facilities use the state supply. I think that was part of the question.
Thank you, David. We have one more hand raised from KRQE. And so I'll just ask this reporter to identify themselves by name since it's not identified in their Zoom handle. Go ahead, please.
Sorry, can you guys hear me okay?
You're a little faint.
A little faint, okay.
Oh,
I'll
no.
raise it up just a little bit more here. Sorry about that. I wanted to ask this is Chris McKee from KRQE News 13. Sorry about the name thing. Question I had was, one of them is a data question. Wanting to know where the number comes from, the one that you guys have online about the population of New Mexico residents eligible to receive vaccine, age 16 and over. That's a 1.68 million. I'm wondering where that number comes from. Is it census data? Is there a particular year of census data that it comes from? Obviously, it's 16 plus. I'm wondering where exactly that number comes from. And then a second question, I wanted to go back to the every county is in turquoise. And so from what I gather, essentially, had the sort of governor not decided to just sort of say everyone's going to remain in turquoise, some of these counties would have applied to the rules of the framework as of, say, 2 weeks ago or when the last health order was, and some of them indeed would have been yellow, if I gather that correctly. And I guess maybe I just wanted to circle back and ask, what really is the reasoning of that? Is just the consistency, keeping folks at the same status and moving towards reopening? And what do you say to the people who are going to be maybe upset about that and say, you're moving the goalpost again, even though it's sort of beneficial to these counties. You know, there are going to be people who say, why you change the rules again? Can you give me sort of an idea? Thank you.
I can start with that one. We don't get a lot of complaints when we change the rules in a way that seems to favor people. So we like being consistent, though, and I think really it's the vaccine. The fact that the vaccine has been so effective, that our case counts are so far down, and I think that we think there'll be other incentives to move people along in the in getting their populations vaccinated by county. I mean, obviously there's other factors that must be at play if you have a threefold difference in the percentage of people vaccinated. And so I think that I think it's just an opportunity to do everything we possibly can to give the economy a chance to regrow and things to reopen more and businesses to do better every chance we can. So that's my take on why all turquoise, even though the numbers aren't perfect. I'm going to take it to Tracie to answer the rest of the questions.
Yes, and thank you. Appreciate that, David. So as far as the data, it's from our New Mexico indicator-based information system, which is a population survey, and it was collected in 2019. So that's the source of the number that you see on the dashboard. And was there a follow-up to that, David?
No, I think that was mostly it. Chris, did we cover it? I was looking something up. All right. And then,
Dr. Collins, if I may, just to clarify, this is Matt Bieber speaking about the question on incarcerated folks. Those folks are not, in fact, eligible for the sweepstakes.
Thank you, Matt.
Thank you, everyone. Those are all our questions that we have today. Oh, well, Julia Goldberg has raised her hand, so she can ask a question. Go ahead, Julia.
Thanks, Alex. I figure you're already annoyed with me, so I might as well go for broke. I just wanted to ask really quickly, Dr. Collins and Dr. Scrase, you both spoke to the American Medical Association in January, and at the time said you were exploring vaccine incentives. And Dr. Scrase, you compared them to the ones used in Medicaid for health behaviors. Is that what we're talking about with this lottery? Do you think that it will work sort of the same way as those Medicaid behaviors you talked about then?
Yeah, everyone has a different personal economy for making decisions, Julia. It's a great question. I think I took several econ courses in college that really dealt with the idea of personal utility and what it is that makes us want to do things. But in the end, at least economists, who sometimes are just a teeny bit too cynical for me, but I really like the way they use so much math. They sort of feel like we all do whatever we do because we feel we have personal benefit from it. And so I think evidence in other states has shown that when you offer like a lottery type incentive, all of a sudden that personal equation, that personal utility for people comes into play. Now, someone who's really rigidly opposed to the vaccine probably wouldn't be swayed by the chance to win $1 million, although that's a pretty rigid approach, in my opinion. But I think that, I think we're hoping to see more rural counties, folks line up and for the vaccine. In Medicaid, we have this little incentive program that's rewarded people for many, many, many years, actually, for doing things like getting health checkups for your kids. We did add the vaccination in there. I think it's worth 200 points, which is the equivalent of $20 for Medicaid recipients. That's been in place since January. But I think, it's hard to measure whether that's been effective. But I believe that hopefully that middle group of people who just haven't really decided what they want to do about the vaccine will actually be swayed by this and show up and get their shots. And to a previous question too, like if it turns out that 10% of the population actually got their shots in Texas and they're motivated to go online and put that data in the DOH database, like I'll be a super happy camper. I'm sorry that they're not eligible for the lottery, but the more people that are vaccinated, the safer our community is. Tracie, anything else on that one?
Yeah, I think I agree with what you said. I just want to add that in states that have implemented incentives, we have seen an increase in vaccination rates. In Ohio, as an example, they saw an increase by 53%, and that was across all ages and in rural communities. So I think it's really, there's evidence that it's a positive, the result's positive. Thank you.
Thank you, everyone. And so we'll move on to closing comments from our speakers. And I would just like to take an opportunity and thank our speakers, particularly our secretaries, for participating in these press conferences over the past 18 months or so. So thank you for providing information to New Mexicans. I also want to thank our media partners, as well as our ASL interpreters and our Spanish language interpreters for making sure these press conferences are accessible to a diverse breadth of New Mexicans here. And so with that, I think I'll turn over to Secretary Collins and then Dr. Ross and then Secretary Scrase for ending comments.
Well, thank you. I appreciate everyone joining us today. It's been a pleasure to be on the panel with Dr. Ross, Dr. Scrase. And I just want to encourage people, if you're not vaccinated, please strongly consider and go and get yourself vaccinated. It is really our hope for getting back to our normal life and being able to interact with family and friends safely and to feel comfortable. And I feel like we're at a good place, New Mexico. So let's not only reach 60%, let's surpass it. So thank you. Dr. Ross?
Sure. Thank you, Secretary Collins. And I would have to say, it's really my pleasure to join you this afternoon. And as a medical epidemiologist, I have to make this statement that even though we've made tremendous progress, we know the pandemic isn't over. So that, as my perspective as an epidemiologist, I must share that. So please be safe, New Mexico. And how can we be safe? Get vaccinated. And I just want to emphasize that over and over. The vaccines are safe and they are highly effective. Please get vaccinated. Also, testing is an incredibly valuable tool. If you have symptoms consistent with COVID-19, please seek out a test and follow up by seeing your provider. And then for those amongst us who are still unvaccinated, again, please be safe. We know that masking is highly effective. We know that distancing is effective. So please use your mask socially or physically distance when it's appropriate, and overall just be safe, New Mexico. And I'm just thrilled to be here today and to be able to join you and celebrate our progress that we've made to date. Thank you.
Yeah, and I would just say get vaccinated, just because I would say that every place I go. And everyone should really consider it. Please talk, don't listen. I mean, there's actually data that shows people don't listen as much to public health officials as they do like their personal practitioners. So talk to that important person in your life who you make healthcare decisions with and make the decision with them. I want to thank Alex for reminding me and including other people that I missed. Our ASL interpreters have actually been They were there back. Hey, you guys remember when we did press conferences in person together? So some very familiar faces there. And just again, for me, I get really excited when we have opportunities to see the economy open more. Not because I need to go to a restaurant every night, but because I know and I'm friends with a lot of people who own businesses and who really have been through a tough time this past year. So it's exciting to me when we can actually relax the rules as well. We were, as you know, not hesitant about tightening them up when it was necessary to do that. And I like that we're actually willing to loosen them up now that we have more success with the vaccine and we think we have more room. Every time we've done that over the past 3 months, our predictions have proved true. We've had good results in schools. We've had good results with red, yellow, green, turquoise, and I think we're getting really close to getting back to something close to a normal life for most of us who are vaccinated, and still that pandemic out there for those who aren't. So with that, I'll say goodbye. Thanks again to my panelists as well. And I suspect we'll see you in another couple of weeks.